The writing was on the wall from the start. Only the government refused to see it. Now, the WHO's letter to the provinces expressing concerns over the steep spike in COVID-19 infections across the country owing to easing the lockdown without effective disease transmission control or surveillance system has only confirmed our worst fears. The government had erred in lifting restrictions and opening up the economy after 2 months of closure. Its actions have caused infections to spike and overwhelm the country's already overstressed public health infrastructure. Every call for extension in the virus lockdown was dismissed as an elitist plan. The lockdown was lifted on the plea that Pakistan could ill afford a longer closure as the shuttered economy would kill more poor people than would COVID-19 infections. Consensus was missing as the centre berated Sindh for pursuing stricter measures and encouraged businesses to demand the removal of restrictions. It was also troubling to note that the superior judiciary view that COVID-19 apparently is not a pandemic in Pakistan. A month after the government ordered the easing of virus restrictions, the country has confirmed more than 1,15,000 infections and some 2,300 deaths, with each day recording a higher number of cases. Now Pakistan ranks 15th on the list of countries with the most COVID-19 infections and is among the top 10 reporting the highest number of new cases. The disease has spread to every corner of the country and hospitals are reportedly turning away patients because they don't have enough beds.